Hi guys, my name is Kayla, and today I'm going to be talking to you a little bit about the accessibility of mental health care. We live in a society nowadays that feeds off of readily available, accessible things. Our news, entertainment, and information are all accessible to many at just the touch of our fingertips. Family and friends are just a phone call or text away. Many services, such as food and retail, have expanded their scope of accessibility to reach consumers everywhere. Healthcare services are also now beginning to be accessible just by a quick video chat. As technology, services, and information have grown in many ways, so too has the means by which we access it. But what does having accessibility to things really mean? And how can we improve accessibility where it's significantly needed? So what does accessibility really mean? Simply defined, the word accessible refers to something that is capable of being reached or capable of being used or seen. When that definition is applied to services, having truly accessible services means those services can be accessed and utilized by everyone. With healthcare being such a critical service to all people, there are many ways in which accessibility has begun to increasingly be approved upon within the health sector. However, there is a disparity between access to physical health and mental health services, with the mental health sector suffering from lack of focus and growth. There are many factors that contribute to how accessible mental health services are to clients. While deficits in many of these factors may combine to reduce the likelihood that an individual receives services, sometimes just one of them can be an overwhelming barrier. 7 of these factors are availability, proximity, income, language and culture, disability, awareness and knowledge, and stigma in society. Addressing each of these in a way that identifies their current deficits and provides suggestions for growth can help our society advance in the way we view mental health care accessibility. This in turn allows for the advancement of necessary changes so that everyone can have equal access to the services they need. The first factor of mental health care accessibility I'd like to discuss is availability. When examining the accessibility of mental health care, one first must look at the availability of mental health services. This involves looking at the number of providers in an area, as well as the patients per provider. For example, if a community has a large number of psychiatrists, and each one has a reasonably low number of patients, then the community would be considered to have a higher rate of accessibility of mental health care because it was more readily available. However, if that same community had fewer psychiatrists but the same number of patients, the patient-to-doctor ratio would be high, meaning there was less availability. There are many causes for a lack of availability of mental health care. One study found that an overwhelming cause for this was that the number of psychiatrists has declined. It noted that while other types of specialty doctors increased in numbers from 2003 to 2013, some as much as 35%, the number of psychiatrists decreased by 0.2%, and that when the number of psychiatrists was adjusted for the population size, the mean number of psychiatrists decreased by almost 10%. While this may not seem like a large number to some, the distribution of practicing psychiatrists is such that in some regions studied, there were as few as 13 psychiatrists per every 100,000 people, as the number of those practicing has not grown along with the population. As of 2018, the National Alliance on Mental Illness, or NAMI, reported that 60% of all counties in the U.S. did not have a single practicing psychiatrist. With the number of available psychiatrists decreasing in a growing population, action must be taken to ensure mental health care access. In order to increase availability of mental health care, there are many measures that could be taken within the United States. This could start at the college level by offering incentives. In the aforementioned study, the authors suggest that incentives such as loan repayment programs might motivate students to pursue psychiatry. Allowing for the education of primary physicians to diagnose and treat more mild mental health issues like depression and anxiety may also relieve some of the burden off current practicing psychiatrists, allowing for more patients to be treated. Although they do not have the scope of diagnosis and prescribing that psychiatrists do, other mental health sector workers, such as therapists, social workers, and counselors, are helping to try and increase availability by working with psychiatrists to provide comprehensive treatment instead of psychiatrists being primary providers for patients' mental health needs. Another important factor into the accessibility of mental health care is proximity of mental health services in relation to those seeking care. Services are only as valuable as they are reachable. If clients live too far away from services, or if there are not adequate methods of transportation to them, then it does not matter what mental health services exist because many clients won't be able to access them. Rural areas in particular tend to carry the burden of lacking mental health care more than urban areas. A study of the state of Nebraska found that 65% of the rural non-metropolitan counties were lacking psychiatrists, whereas only 27% of the metropolitan counties lacked psychiatrists. Another study collected information from clients through peer workers in rural areas. It cited lack of services, lack of transportation, and distance as the biggest reported barriers to accessing mental health care. Clients living in rural areas who had adequate transportation often also were deterred from seeking help due to the cost associated with commuting to and from offices and hospitals. When it comes to solving this issue, studies have all diverted back to availability as being a direct correlation. More available mental health professionals practicing in rural areas or within reasonable proximity would help alleviate issues for clients who may have inadequate transportation or lack funds to commute. Like with availability, it is suggested that more incentives be offered to those who want to practice psychiatry, especially those in rural areas. An increase in funding to support these positions and expand mental health care would also greatly help in increasing people's access to mental health care close to them. A third important factor into the accessibility of mental health care is income. While having mental health care close enough to reach is a significant factor for many, sometimes money is a far greater influence as to whether a person receives services or not. It doesn't matter how close in proximity to mental health services an individual is, if the services are not affordable, then they are not accessible to that individual. Many people who need care are deterred by this factor alone, and in turn wait long periods to, or never, receive the care they need. In fact, the average time it takes for a person experiencing symptoms of mental illness to get help is 11 years. So why is this? In the US, mental health care is a costly industry. For example, let's look at depression or major depressive episodes. Out of the 47.6 million adults who experience mental illness, 17.7 million experience depression. Depressive disorders alone have become the most costly health conditions, costing the United States $71 billion annually. This includes money spent by patients out of pocket. Depression ranks 6th out of all of the most costly health conditions in the United States. With such high cost to access care, it seems inevitable that many would go without care. Although insurance may cover services for some, it's not a reality for many who are suffering. In a study on primary care physicians and how they view mental health, it was found that 59% of physicians reported not being able to get outpatient referrals to appropriate mental health care for patients due to lack of insurance or underinsurance, and viewed this as of utmost concern and importance. Even though some patients who are uninsured may qualify for free or discounted sliding scale fees at community-run mental health centers, these discounted services are decreasing due to lack of funding from the community and government. In order to combat this, it is vital that mental health care continue to be funded so that healthcare reform can take place. A fourth important factor in the accessibility of mental health care is language and culture. Those who are part of various minority groups or cultures, or whose primary language is something other than English, often have barriers to accessing mental health care due to communication or cultural issues. Researchers in California performed a study of over 40,000 adults. It found that of the 16% who expressed a need for mental health care, only 45% received services. Within those who did, 14% were bilingual and 16% spoke no English. Only 42% of the bilingual individuals and 8% of those who didn't speak English received care. Another relevant cultural study conducted about the perception of depression among Latino immigrants revealed that Latino individuals tended to refrain from seeking treatment due to fears of deportation, lack of money, and lack of providers who speak their native language. According to Sewell, research has failed to enable consensus to be achieved about the role that ethnicity, race, culture, racial identity, and ethnic identity play in patterns of mental health care service utilization. These issues contribute to differences in the pathways into service, the way that services are provided, and the service user experience. Black and minority ethnic groups tend to have higher numbers of individuals using community services, but are also greatly dissatisfied with the care they receive, use therapy less, and are placed into seclusion when hospitalized more frequently than individuals from white groups. There is not one clear thing that causes this disparity in care, although theories suggest that factors such as historically racist practices, religious beliefs, or even biological makeup could contribute to whether the person receives adequate mental health services. To help alleviate this, professionals need to take into account the whole person, including their language, race, culture, and ethnicity, so that they may understand the person in their context of daily life. Practitioners should be offered further training and education in how to deconstruct institutional racism and instead put in place positive practices that identify culture, race, language, and ethnicity so as to provide better services to a wider scope of patients or clients. Having available language services, such as interpreters, can also greatly increase access, especially in places where large numbers of the population speak another language. A fifth important factor into the accessibility of mental health care is disability. When people hear the word accessibility, they often associate it with disability access or how usable or functional an object, service, or environment is for a disabled person. Having accessibility in mental health care for disabled persons means that the services provided can be fully utilized and are easily able to be reached. For example, let's say a community mental health center is in a large town is on a bus route which is easily utilized by persons with disabilities. The building is outfitted with accommodations for these persons to easily navigate, and the staff is trained so that they are aware of and understand these accommodations and are available to offer help. This mental health center would be considered accessible by disabled individuals because it is reachable and able to be navigated and utilized. However, take that same mental health center with the same accommodations and put it outside of town, but not near a bus stop. Then it becomes inaccessible by disabled clients who use the bus for transport. Or, if the center was still in town, still outfitted for accessibility on the inside, but did not have an appropriate wheelchair ramp to enter it, it becomes inaccessible. These things may seem like small details to some, but for those with disabilities, they can mean the difference between getting help or not. Several measures have been enacted which many believe should have helped accessibility become far easier for those with disabilities. However, these measures have not been as successful as they were expected to be. The Affordable Care Act, passed in 2010, aims to make healthcare, including mental health services, more affordable and available for all people and was meant to improve access. However, one study collected data from those with disabilities both before and after the passing of the Affordable Care Act and found that for many disabled individuals, the likelihood of being uninsured and foregoing or prolonging obtaining care actually increased slightly. The passing of the Americans with Disabilities Act in 1990 was meant to prohibit discrimination based on disability in all areas of life and provide protection for disabled individuals. While this act provided some help in areas of physical disability, it has not addressed all the needs of those with mental disabilities or mental illness and physical disability both. The Americans with Disabilities Act does not require equality of mental and physical disability benefits, despite the fact that mental disorders account for 4 of the 10 leading causes of disability for persons ages 5 and older in the U.S. This leaves many with mental disabilities from severe mental illness struggling. Although combating this issue is hard, there are some steps that can be taken to improve mental health care accessibility for those with disabilities. An improvement in staff's education on working with disability accommodations and how to assist those individuals who need it can help provide more opportunities for mental health services to grow and adapt. Although it is difficult, action must be taken and supported on developing and implementing legislation that aims to help those with disabling mental illnesses. The sixth major factor that affects the accessibility of mental health care is awareness and knowledge. Surprisingly enough, awareness of mental health problems and services and knowledge of how to access these services still remain a barrier for many people needing care today. While some have issues with searching for a particular service they need, others may not be aware that such services exist at all. A survey conducted nationally about mental health found that many Americans have little knowledge of how to even identify a mental health problem. It revealed that less than half could identify anxiety, and when asked how to treat depression, most did not know. In another study, veterans who had received mental health services were surveyed as to why they delayed care. Many reported not being provided with information about when or how to access VA mental health services. Many ways to combat this issue have been proposed and some have been implemented. One that is increasingly used is the screening of patients for mental health issues during routine appointments with general practitioners. This allows the patient to gain help in a setting that they are familiar with and can give the provider opportunity to make them aware of and refer them out to other services if necessary. Availability of informational materials in clinic settings, including brochures, flyers, websites, mobile apps, videos, and other multimedia with information about symptoms and prognosis, as well as services offered, can also be helpful in reaching a wide range of individuals. The seventh and final factor affecting the accessibility of mental health care is stigma in society. The brain is arguably the most powerful organ in the human body. Just like when another part of us gets sick, so too can our brain. However, due to a historical lack of understanding, a stigma of shame and fear remains, burdening those with mental illness diagnoses. This stigma is further perpetuated by faulty depictions of mental illness in the media. The stigma attaches to the person who is diagnosed, leaving them often attempting to mask their mental illness in fear of judgment or causing shame for those who have more apparent symptoms and/or seek care. A 2013 poll showed that 47% of people said they would not be comfortable simply just living next door to someone with a serious mental illness. There are currently many different efforts underway that aim at reducing the stigma around mental illness. Organizations such as the National Alliance on Mental Illness, or NAMI, provide information about mental illnesses, as well as planning awareness events such as NAMI Walks and Mental Health Awareness Week. Legislation has also been slowly developed in order to combat stigma. In 2004, California passed the Mental Health Services Act, which taxed the personal income of those making more than $1 million and used that money to help fund wellness and prevention efforts in the public mental health system, as well as expand services to underserved populations and California's diverse communities. With all the barriers to mental health care our society faces, it can be easy to feel discouraged and doubtful that we as individuals can make significant change for the better. Like all changes, though, it can begin step by step. Changing the way we talk about mental illness from a shameful topic into a conversation about wellness can help reduce the stigma. Educating communities on the signs of mental illness and available treatment options can help to promote healing and growth. Continuing to push for legislation that brings about equality in mental health care and physical health care can allow more people to access the services they need. Finally, providing advocacy for those with mental illnesses can allow for those who may not know how or where to seek treatment to find the services they need. There may be many barriers to mental health care, but there is still so much we can do, and things are looking up.